Fierce face-offs, heads will definitely roll, and even more earth-shattering injuries that may or may not be compatible with life. Today, we are back at it, breaking down and reacting to all the aggressive medical scenes from Invincible. Let's dive right in.
You're never breathing again.
Choking the individual, compressing the blood vessels on either side. So you have your carotid artery and jugular vein. When you're not getting blood up to the brain, you're not getting oxygen to your tissue. People end up passing out. You're not having oxygen to your cells, equals stroke. If they're strong enough to compress this way, you can actually close off the trachea if you can compress down the cartilage. Oh, never good when you're just getting your back slammed against the ground. The more frequent injuries outside of like bruising and contusions are basically spinous process fractures, spots that you can actually feel on your spine in the back. Those can break. You can also have rib fractures as well. Ooh. Getting punched in the face. Everybody loves punching people in the face. People will come in with one trauma to their face. You see swelling, maybe a fracture to the mandible. Then you see the person who actually did the hitting and they come in because they potentially have a boxer's fracture. Oh! Ow! Ow. Amputation by biting. Can this happen? Yes, it can. And in the comments, people are like, is the amount of force that you would use to bite a carrot. There's not that many studies about that. The bite is not smooth. It is very jagged. There is issues relating to bloodborne pathogens, to the individual biting. Then the bacteria that's in the person's mouth is now getting into the person's finger, which increases the risk of cellulitis. Penetrating trauma directly through the abdomen. This is definitely not a survivable injury if you were a human.
I'm a human!
Going straight through your intestines, straight through your aorta, straight through the inferior vena cava. What is it related to? What's more common that we'd see where somebody would lose this much blood so fast? It's usually when you have an aortic rupture, when somebody has a AAA, so an abdominal aortic aneurysm.
All clear.
Oh, not all clear. What? Not compatible with life. Gotta have a significant amount of blood flow first because the heart actually will still be pumping just for a few more seconds. Oh, everybody's head's coming off. Get down. Oh, through the body. Oh my gosh. Good depiction of trying to show us the minimal amount of anatomy that you'd be able to see on a cross section like that. Unlikely that you're going to get to medical care fast enough. This hit your renal system. This is probably going straight through your pancreas, your liver, your spleen, and then through the intestines. Oh, knee to the face. This is like your mid-face injury. So you can have what's called a Lafort fracture. You can have a nasal fracture. This also can go straight through your frontal sinuses. The bleeding is appropriate for the type of injury that's occurring here in the face. In your face! Oh, trauma to the abdomen causing blood to come out the mouth. He previously had facial trauma causing bleeding to go into his mouth. He's got a nosebleed, right? So how many of you have had a nosebleed where you get blood in your mouth? It's quite common because the nose connects to the back of your throat. Ooh, ooh. Facial trauma due to getting punched, but then add forehead to forehead. Where the frontal sinuses are, not as strong in the bone versus higher up, where the person is using it to hit them is not causing any injury to themselves. This is actually depicted pretty well and more accurate than you would think. Oh. Particles to the eye is the worst foreign body in your eye. Causing you to have some blurry vision. You can actually scratch your cornea. We have so many people come to the ER with the sensation of a foreign body in their eye. We will do an eye exam, try to remove the foreign body, and then if there's a scratch to the cornea, we'll help give you some medicine to make it heal fast. Ooh. Nice. Penetrating trauma to the hand. Remember, I always say don't pull it out. In the hand, it's probably okay to remove the object. Just know that you need to watch for a significant amount of bleeding, put pressure on the area, and get to the hospital ASAP or any medical care that you can find. Ooh. Oh, black eye so bad on the left that it causes the eye to swell and close. If you do come in with this type of injury, we actually pry the eyelids open. So that way we can actually see your eyeball and make sure that it looks okay. You can see out of it. If you don't know that there's an underlying injury, you're going to miss it and it might be permanent. Whoa. crazy. So his character is just on fire. It looks like there's just like lava everywhere, magma. We do see significant amount of burn injuries that come to the hospital. Most common are like hot water, hot oils, cooking. People will typically come in with 1st and 2nd degree burns, but you can get 3rd and 4th. Going into the abdomen, burning through tissue. So as you're burning, you're actually cauterizing as well, so you won't have significant amount of bleeding, but you're going to have trouble healing and the injury to the underlying structure that actually is just melting away.
You'll see how I...
We're missing a left arm, and we have a significant amount of tissue missing from the abdomen. Make sure you find that left arm and bring it with you if you end up going to a healthcare facility. You'd also want to stop the bleeding, so direct pressure or tourniquet. Massive weapon to the skull, splitting into the brain, likely not compatible with a human's life, going into your brain tissue, bleeding, splitting your head in half. Some of these face-offs are enough to put your nervous system into full fight or flight mode. Exactly why I created Chillax by my company Life Happens, to help support relaxation when your body feels stuck in that high alert mode. Check out Chillax at lifehappens.com or on Amazon. What the heck is that? Oh my gosh. We deal with a lot of people who get bug bites that come to the emergency department. Usually you see somebody who has like a small abscess. They're like, oh, it was a spider bite. Well, I always ask, did you actually see the spider? 95% of the time, there was no visualization of any insect or spider that bit this individual. Uppercut. Right jab. So this type of force, you kind of think, okay, what is he actually doing? You're causing enough blunt force that the energy is going deeper into the tissue, which actually can cause bruising to underlying tissues. You can lose blood volume, breakdown of cells, so you increase the risk of potential rhabdomyolysis, which then also increase the risk of renal failure. Whoop. Uh-oh, it's gonna explode him out. Oh. Oh. So many times we have people come in significantly distended, feel like they're going to explode on the inside. Could be gas, could be stool, could be a bowel obstruction where the intestines twist on themselves and air can't get past anything. This typically happens related to infection or previous surgery to the abdomen. Invincible, pretty cool, really crazy. But if you enjoyed this, definitely check out this playlist right here, binge watch everything, and make sure that you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.